So we've talked about these rounds of treatments and what the overall treatment looks like, or treatment plan, I suppose. But when you're actually in the treatment room receiving acupuncture, what does that feel like? Are the acupuncture needles going to hurt? And how many needles are you going to have to use for my condition?
Great. So first of all, a lot of people come in really scared of the needles because they're picturing big hypodermic needles that they get when they go to see their regular doctor. These needles are hair thin and they're nothing like that. They're much, much smaller. The sensation that you will get from these needles is also quite different. Sensation is something that people often want to know about. Sensation will vary, just like everything in this medicine, based on what we're treating and the patient who's on the table. Some patients will be very sensitive to the needles. Very little sensation will have big results. Other patients and other conditions will want heavier sensation in order to get the results that we want. It's very clear, and we line this out as on that first treatment, what kinds of sensations we want. In other words, what kinds of sensations are therapeutic in nature and what kinds of sensations are not therapeutic. The kinds of sensations that are not therapeutic are actually the ones that people are scared of, right? The sharp, stingy, burny sensations that you might expect from a needle. Every now and again we do get those, but those are not therapeutic sensations. And so if a patient's experiencing that, we'll pull that needle and keep moving. There's no reason that the patient should feel uncomfortable during their acupuncture treatment.
Okay, so how long does the treatment take?
Good. I like to have a patient on the table for at least half an hour with the needles in. And there's nothing during that time that the patient really needs to be doing to make the treatment go any faster or be any stronger. Oftentimes patients will take a nap during that time period. That's great. I want them to have as much rest as they can get while the needles are in.
And so it's a 30-minute period that you've got needles. What if I need something during that time?
Yeah, we have a little doorbell that we leave with every patient. It has a button on it they can push that calls the practitioner up front. If they need something during treatment, there should be no hesitation but to use the doorbell, and we'll come back and check and see what they need.
Okay, cool. Where do you think the most common places are for needles to be placed?
It's a great question. So it really, again, it depends on what we're treating. Oftentimes, if we're treating internal medical conditions, they may be more spread out, bilateral in nature. So we will be treating the hands and the feet and the lower legs and maybe the abdomen, maybe the back, depending on what we're treating. If we're treating pain, orthopedic injury, that sort of thing, we might be working quite intensively in the area where there's pain. So shoulder pain may require us to work on the shoulder, both from the front and the back.
Awesome. I think that's all my questions for now.
Great. Well, thanks for your well thought out questions.
You're welcome.
And y'all let us know if you have any more questions, and we'll be glad to answer them in this forum. Thanks so much.